Hello, everyone. I'm doing another interview with one of my, a friend and colleague here in Austin, Texas, a physician, Carol Ann Linebarger with 360 MD. It's a direct care physician concierge practice here in town. She does great work, and I love working with her patients and such. But what I'm excited to talk about today is a treatment that she has been using with her patients called BPC-157. And I'm excited to have her here today to kind of talk about that, what she's using it for, and some of the kind of exciting results that she's seen and that I've seen after working with some of her clients and such. So without any further ado, Dr. Linebarger, welcome. And thanks for being here this morning.
Great, thank you.
The topic of today, which is that BPC-157. I mean, it sounds like a battleship or something, but what is this? What is this BPC-157? And so kind of tell us a little bit about it and then how you got introduced to it and such.
I don't know exactly how long it's been around, but I know that there's been studies on it for healing and recovery from injury for over 25 years. It's called body protective compound. It is a natural compound that is found in gastric juices. That is what we know about it. The kind that we take is a synthetic version. So we do take a synthetic version of that comes from that. From a peptide that is found in gastric juices. It is used different ways, mostly for reflux and like gastric reflux, and then for injury recovery.
And all very fundamental for healing and probably expediting the healing. So that's pretty cool. So it almost sounds like it kind of accelerates the healing process or kind of gives it a jump start. Is that?
It seems to, and you need blood flow for healing,
yep.
Right? So that's why a lot of times we'll talk about, people ask a lot about using ice versus heat and stuff like that. And there, as you know, there are reasons to do both. But when we want healing specifically, when you want to reduce inflammation a lot, we will use more ice. But healing needs blood flow. So that's how you bring the growth factors that will help heal. So that's why doing things like BPC-157 that increases blood flow will speed up recovery.
Yeah, no, that makes total sense. And that's definitely something that I preach as well to my folks and such, and kind of knowing when to, ice and heat do have their place, but kind of knowing when in that healing process to use it. Yeah, I love that. I think the other important part that you were just talking about with the blood flow is that blood flow has oxygen. That's probably one of our best parts of healing, is getting the oxygen to the tissues to kind of start that chain of events for healing. So that totally makes sense on how that increased blood flow would help with those injuries. Perfect. So I'm curious then, so this has been in your practice for, I don't know, how long has it been in your practice, and what have you started kind of using it for? I'm just curious on what injuries it's that you've used it for.
I've always been interested in MSK, musculoskeletal injuries. I was a college athlete. I was a yoga teacher trainer. I was a CrossFit instructor. And I would say fitness is probably my biggest hobby outside of medicine. So when I started doing the concierge model and getting interested in longevity, I started doing training courses in longevity medicine. And then I was doing, I think, HRT. I'm pretty sure it was through doing hormone replacement that I came across peptides. It was just kind of in the same world and in the same training and the same conferences that a lot of longevity people go to. And then I learned about peptides. So I did 2 different peptide training courses, and BPC-157 is one of the most commonly prescribed. So then I isolated a few people that I thought could benefit from it. I initially started using it in capsule form for people who had reflux and were taking lots of Nexium and other PPIs, and I was trying to get them off of that. And I had great success. I got people off of their PPIs and Zantac just by doing a 3-month course of BPC-157. Then I started doing it in the subcutaneous injectable form.
That's amazing stuff.
And the maximum dose that is safe is extremely high. So compared to the amount that we usually recommend. And so when patients have multiple sites of injury, I have a guy now, he has a diagnosis of rheumatoid arthritis, and he is using it in several areas. He just has inflammation in his elbows and his knees and his shoulder. So he's been using it pretty frequently and has had very significant results. Sometimes it's easier to do by yourself than other times. I mean, if you have a neck injury, it's kind of hard just logistically to do, but when it's your knee, or in my case, I used it myself on a hamstring tear that I had, and they're pretty easy to do on my own.
That's amazing. I love that story though on the water skier, because those inner thigh, groin, adductor injuries can be really tough to recover from. That's pretty darn amazing. A little anecdotal story on my end. I was at a dinner just a couple months back, and I had ironically just learned about this peptide, I think through you and through a conversation we had. And literally that weekend I sat down with a dinner and it was actually with a couple physicians. The gentleman was in his mid-50s, had just had a rotator cuff repair. Well, I take that back. It was about 6 months prior. And he brought up, hey, have you ever heard of this BPC? Because I used it with my shoulder. And I'm like, I just learned about it this week. Tell me about it. And very similar story. He used it, I think after a few weeks post-operatively. And the results were shocking to his surgeon, because he was back, his range of motion, his strength were back in record-setting time. And his surgeon was shocked. So there's something to this. Now, granted, anecdotal stories, but definitely very interesting, exciting stuff. Very good. So we've talked about kind of what injuries you've treated and such. We've talked about the dosing and such. Are there any folks who this isn't good for, or as we say in the trade, contraindications? Are there, what's the safety on it and such, or,
It has it's very safe. The safety profile is definitely very high. I have had 0 side effects. So I tell patients it either works or it doesn't. And the one patient that I had that it didn't work on, he had confirmed osteoarthritis in his neck, and he had no side effects from doing it, but it didn't work. So it doesn't work well for people who have irreversible injuries.
Sure.
It works for people who have inflammation. They have an injury secondary to inflammation or something like that. So that's who it works really well for.
Okay. Awesome. Very cool. Wonderful. We talked about some of the outcomes and such. How much does something like this cost? Is this, what's this like for folks? Tell us about that.
Well, I am aware of some clinics in town that charge a lot for it. They'll charge $20, $30 for a one-time shot, which not make sense for most people, because to be effective, it is not dosed one time. It needs to be dosed daily. And so you should find a place that gets it from a reputable FDA-approved pharmacy, because it is not an FDA-approved medication, but it is made in pharmacies that are FDA-approved and regulated. We charge about $250 for a bottle, and that bottle will last 30 to 60 days.
Okay.
So I think that's
reasonable.
I would say patients, wherever they go, should not pay any more than $400 for a bottle of it to last 30 to 60 days.
Gotcha. Okay. But I think one of the biggest things you said there was making sure it's FDA approved and such. And for folks to do that, is that a simple Google search, or just kind of asking the provider, hey, where do you get this? Where do you source it?
You need to ask. We are always very transparent about the pharmacies that we use, and we have good relationships with our pharmacies. I've been to all of the pharmacies that we use and seen where their compounds are made. And I've talked to the pharmacist and find out where the actual compound is sourced, because they get the raw product from a source, and the source has to be, if you get it from the right place. I will only get it from a place that their raw product is sourced from an FDA-approved distributor.
Gotcha. Wonderful. Well, very good. Very good. Well, this sounds just like something that is really exciting, something that I'm going to be able to offer to not personally offer, but say, hey, there's something out there that you might need to consult with your physician, consult with Dr. Linebarger about, finding out if this is right for you. But super exciting. I love the fact it sounds like it's natural. It comes from a, the origin of this peptide is that it comes from us. So that makes me feel a little better. Like it's a, the body can identify with it and such. So that just seems, puts me at ease when putting in a medication in myself. That's great. I love this. Well, very good. So for folks, if they were to want to learn more about this, best place to reach you is the obvious going to like the website, or learn more about you? Okay.
Our website has information about peptides, 360mdaustin.com. They can call our office and schedule meet and greets or schedule an appointment. And I'd love to talk more about it with anyone who is interested.
Awesome. Love it. Love it. Well, appreciate it. Thank you so much for your time today. And perfect.
Thanks, Eric.
Right. Thank you.